You're watching KCAL 9 News at 2.
Runny nose, sneezing, watery eyes. Sounds like you we're talking about here, Sandra. If you've ever suffered from a cold or allergies, there's a chance you might have had sinusitis.
Yeah, a lot of people affected, especially on windy days like today. How can you tell the difference, though? Well, today, joining us, Dr. Marc Kerner. He's going to help us. He's going to tell us all about this new treatment. So first off, let's talk about, Doctor, how do you know if you have a cold or something else going on up there?
Great question. Thank you. The way we can figure that out is anything that lasts for more than a week, whether it's stuffiness, runny nose, itchy eyes, we'll typically say a cold that's lasting 5 to 7 days or longer can be a sinus infection. And the true way to make that diagnosis is to be able to look into the nose with a telescope and actually see the sign of infection. A lot of people get treated for sinus infections when they just have a cold. But what we need to do is delineate whether it's really a sinus infection or a cold. And then the people that get recurrent infections, whether they have allergy problems or difficulty breathing through their nose, those are the people then that typically suffer, especially at times like this, where the weather changes and the pollen counts increase in the environment.
And why are some people more prone to getting the infections than others?
Right, because the sinus cavities have these very tiny openings. And so what happens is with swelling that occurs with both allergy and recurrent infection, the openings get blocked. And then when you get blockage, then you get an infection. So sometimes the body can clear that. We use a number of conservative measures, like having people rinse their nose with salt water. We use some sprays. We use some other medications, antibiotics. But when those fail, because those openings just become so blocked off from all the recurrent infections, then we actually have to do something to open them up.
Now, a lot of people get a sinus infection once or twice a year, maybe. How do you know if it is a chronic problem that you need to take it a step further and consider surgery?
Good question. Again, by the symptoms, by their history, but also by examining people using those scopes that we talked about, and then CAT scans. So when we do x-rays, we can actually see chronic changes in the sinuses.
And I see you've got a little tool there that if you've got one of those blockages we're talking about,
right, so
you've got a chronic problem.
Yeah, so what we've developed now is we're working on trying to develop more minimally invasive ways of treating these problems. And so one of the newest devices is these balloon dilation devices that are available now to us, where we took the technology from angioplasty and opening up blood vessels to now open up those small openings. And these are flexible, so we can actually manipulate these under direct vision right into the cavities and then dilate those cavities up.
So this is similar to angioplasty, which you would do on the arteries around the heart.
Correct.
How does this work in the nose? What kind of balloon do you use?
Well, it's the same type of thing. It's a balloon that we inflate, and it dilates the opening, and it expands that tissue opening so that you're breathing freely, and then you're not getting blocked anymore. So it opens up those blockages.
And first question anybody wants to know when they see that is there anesthetic involved here?
Well, we do those, most of them under general anesthesia. It takes about 20 to 30 minutes. So just because for comfort reasons, it can be done under local anesthesia too.
And what's the recovery like? Do you get immediate relief?
Within a few days. Ultimately, it takes a few weeks to actually heal, but within a few days, people are up and about, and even next day back to work. And it's really much less downtime now.
And you mentioned maintenance, such as nasal washing. You can do that, obviously, to keep the bacteria at a minimum? Yes,
absolutely. All the things in the environment that are triggering the allergies and the congestion and all the reactions that occur because of the allergies, we have people doing irrigations, and we even use some medicated sprays to actually help keep down the inflammatory changes. But what this is doing is actually preventing people from getting recurrent infections.
Right.
So when you talk about the irrigation, the neti pots really popular right now, and those work?
Neti pots work great. We tell people whatever they're most comfortable using, whether it's the neti pot or just a bulb, syringe, or whatever type of irrigation device. It's really more about just getting the washes in and out. This allows those washes now to get into the sinuses and clean those out better as well.
All right. Thank you so much.
Great, thank you.
Hey, for more information on sinusitis and balloon dilation, just go to our website. The website address, kcal9.com. You can click on Seen on TV.
Very interesting. Thank you, Doctor.
Thanks.
Thank you. All right, a real-life R2-D2.